She's like, I'm in bed.
The best conversations happen at happy hour. Welcome to ours.
Welcome aboard.
This is the PT Podcast. Here's your host, physical therapist, Jimmy McKay.
Good timing, live from CSM 2026 here in Anaheim. Want to say thanks to Empower EMR. If your clinic is stuck with an EMR that's slowing you down, that's your choice. That's your choice. You chose that. You can also choose a way out. Designed for PTs, better notes, faster documentation, smoother operations. I always yell, smooth operator, whenever I say that. All wrapped up in customer support, doesn't ghost you. Upgrade your clinic's brain with Empower EMR. Visit empoweremr.com. In a profession obsessed with specialization, our next guest is here to make the case that being a generalist isn't a weakness, it's preparation. Ben Lindaman, welcome to the show.
Hey, thanks for having me.
Appreciate it. Where are you from, man?
Live in Philadelphia.
Nice.
Yep, right.
Which is where this little shindig will be next year.
Yep. Yeah, I'm right down, smack down the middle of the city in the convention
center. Are you
from
PA?
Born and raised in Iowa.
Nice.
But then moved out to PA for grad school and then just never left.
Fantastic. All right. So there was an Oxford debate a couple of years ago about generalization versus specialist. It was very interesting as Oxford debates, which should be brought back to the APTA. That's a hill I will die on and I'll keep pitching about until it gets brought back. And it was interesting to hear both sides. We like chasing things like titles and specializations. It is neither good nor bad. It just is. So why do PTs feel pressure to sort of specialize or do these things?
I don't know. I think it's a couple things. I think if you like zoom out and just healthcare in general, like physicians, like everyone has a specialty. And I feel like every time I have patients, they're like, yeah, I have to go see the ortho guy, but then he specializes in the knee. And then it's only the right knee, but not the left knee. And I think it's just how our healthcare is designed from a top-down approach. And I think it's just trickled into PT. And there's a time and a place. Like I have my neuro specialty. I'm not here to rag on it. But I think just so often I hear, oh, you need to go see Ben. He's the neuro guy. He's the neuro guy. And I'm like, the people are people.
Yeah.
Like, you don't necessarily need to have the specialization to provide best care for them. So.
I get... people know me because I have a podcast, and people are like, he's the podcast guy. And I'm like, actually, I have a degree in communications and journalism, so I could do words too, or I could do pictures, or I could do a combination of both. So yes, you might be a neuro PT, you're still PT, and there's a time and a place, and neither is better or worse. But where does that pressure come from? Is that is the call coming from inside the house? Or
I feel like
both?
it's like patients, like some want that specialization because they feel that they're going to get better outcomes because of it. So I think it's a patient customer service based
marketing thing.
I
mean, I'll take credit. Yeah. Or I'll take shame.
Yeah. And then I think it's, people want to have that identity of like, I have this thing that nobody else has or very few people have. And so then it promotes this level of autonomy that you maybe don't have as a generalist or in that sense. So I think there's, like talking about it in absolutes, like it's just patients or just therapists or just administration.
Never is.
No.
Yeah.
But yeah, it's just one of those things that it was always kind of annoying when I was in full-time clinical practice was like, I would just get all these people like, oh, Ben, you're the neuro guy. I want you to see this person. I'm like, did you even do anything with this?
Right.
Like, did you eval them? And they're like, well, I don't have, like, you have skills. Like you graduate as a generalist and you, like very few times I had to like truly dig in with my neuro knowledge and like to provide care that probably that therapist couldn't have done. But I'm like 90% of what this person needed was just basic PT.
Attention.
Yeah.
Or a set of eyes, a set of hands, all those different things. What do we lose when we undervalue a generalist? I mean, here's the thing. We're at APTA, 50 state chapters, 18 components. None of the components, there's pediatrics, geriatrics, orthopedic, sports. There's no academy of generalists.
I know.
So maybe it's a little bit of like, well, if I don't belong somewhere, I don't belong.
And I think they're trying to probably funnel that population into like the new primary care and the specialization stuff.
That's a good point.
Yeah. So to me, I view the primary care, this is my own thought, it's like you're kind of now a specialized generalist, if that makes sense.
Now we're just going in
circles. Now we're just talking in circles. But yeah, I mean, it's just also like I enjoy the variety. I enjoy working with people with neurological conditions, but I love treating my runners. I love treating, anybody who has a pulse, really. I'm happy to work with them.
Yeah.
So
well said. So how does value-based care change this type of conversation?
That's a tough one because I think you have to define Like, how would you define value though? Like, what does that mean to a payer? What does that mean to the consumer? What does it mean to me as a therapist? And probably all answers are different.
Yeah.
So
as they have to be. They will be. They have to be.
Yeah. So I don't know. I haven't really given that one too much thought, but I think it would be kind of understanding or triaging or better triaging, like who is truly going to benefit from a specialized individual. And before I came on, I was like looking into some research, and there is at least some research to support. Yeah, if you have like FND or something that's really, really niche, then yeah, you're probably going to be best off with somebody who specializes. And because some of this stuff is coming out of Australia, they're putting a lot more research into this idea of generalist versus specialist. And they're basically just saying, yeah, like you may need a specialist for like certain very niche things, but probably you don't need it for everything.
Yeah. So. I mean, it's probably like a bell curve.
Yeah.
There is an extreme on either side that will need it. And then there's the middle of the bell curve. Mm-hmm. And that's how bell curves work.
Yeah.
Crazy.
It's nuts.
Yeah.
Yeah.
Why is generalist thinking critical in rural and primary care settings?
Because you might be the only person within hundreds of miles.
Or months. The only person in healthcare.
Yeah. And so having that adaptability and that range and that depth of knowledge you're it. So, because these people may not necessarily have specialists with access, even with telehealth. So having that really strong generalist mindset, I think is what's needed, to be honest. And so many times it's just, I had a patient last week who was like, yeah, I went to this physician, I went to this physician, I went to that physician. Now I'm back in PT. And I was like, you just went to 12 physicians and still aren't anywhere near where you need to be. So yeah, I think generalists are what's needed, especially in those settings, for sure.
You can't walk more than 10 feet without running into a pack of students at CSM.
Yep.
It's a constant question from, I don't know, second grade. What are you going to be when you grow up? And then you get close to college. And what are you going to major in? And when you're in PT, where are you going to practice? It's constantly what is next.
Yeah.
So how would you speak to a younger clinician talking about identity and scope in terms of generalists during specialists? How would you tell them to slow it down? Would you tell them to what would you tell them?
So my path into PT was I graduated, then went right into a neuro residency. And I think that accelerated my thinking in some aspects, but I think it really put me in this kind of pocket of, all right, this is all I'm doing and this is all I can do. And then once I actually got out into practice full time, it's like, I actually kind of like more the generalist thing. So for a younger clinician, I think, try it out. Like PT is such a versatile profession where you don't have to be a specialist like, a physician going from med school to residency. So take the first couple of years, work in a place that's going to have lots of variety, right? Whether it's an outpatient, whether it's inpatient, whatever, and not feel pressured to feel like you need to define who you are right when you leave PT school, because I don't think that needs to be the case.
You get one PT license.
Yeah.
And when you want to go from peds to geriatrics, there's no toll booth.
Yeah.
There's no one saying you have to have this thing. And that's a little, it's awesome.
Yeah.
I went from sports outpatient to peds, and I was sort of waiting for someone. I was looking to get pulled over. I was like, where's the cop? And they're like, there's no cop. You can just do that. Right?
Yeah.
And that's, I think, part of our strength, but also maybe part of our weakness when it comes to explaining what we can do, because you're a PT. Who do you work with? And you're like, okay, so I could work with this to this to this to this. So it is a strength, but it's hard to explain.
Yeah.
A profession to people, or the many possibilities.
For sure. 100%.
What would you say to a PT who feels less than for not specializing? How would you make them? I feel like we need soft music. Okay, sit down, look right into my eyes.
I don't know. Where is that thought coming from though? Who put that in your head that you needed to specialize or that you need to do that? I would want to tell that person, well, you need to get new friends, because that thought didn't come from just organically probably. But I think you then just go back to your patient outcomes. Are your patients getting better, even if you're not a specialization?
Do you like doing this?
Yeah. And then is this satisfying to you? If you hate neuro but want to be a neuro specialist, then that's on you.
Yeah.
I think there are people that love specialization and that's their jam, and I'm not here to rain on that parade. But I think it's just my clinical observations and just seeing that it just organically happens where people get boxed into these profiles or, demographics. And I think it just really then is challenging for younger clinicians, because then people just keep getting triaged, and then you never fully develop a skill set, because, younger clinicians would be like, oh, Ben, I want you to see this person with a stroke. I'm like, well, you can still learn from this person. And like, now you're just really limiting your ability to work with all sorts of individuals because they get scared or they're not confident. And I'm like, you can still do the basics really well. And then, if their patient's not getting better, then potentially triage to someone like me. Right. Yeah. But so many people just punt the ball so quick.
Yeah.
And I think that's just limiting your growth.
That's internal, right? That's our own problem. I'm guilty of it. That's why I can spot it. Guilty of it myself. Like, well, I'm not the expert in this. But I heard someone smart say, most of the time, because only the Sith speaks in absolutes. I learned that from Star Wars. Most of the time, you don't need to be the world's expert on anything. I've never been the world's expert on anything.
Yeah.
We need you to have enough expertise to speak confidently and competently.
Yeah.
Confidence and competence is sort of the ticket you need.
Mm-hmm.
And then when you realize, hey, spending more time with me will probably be a disservice, that's when you do that power move, which is a handoff.
Yeah.
When you notice that.
Yeah, for sure.
All right, last thing we do on an episode, we call it the parting shot.
This is the parting shot. One last mic drop moment. No pressure, just your legacy on the line.
No pressure whatsoever. So you can have your own parting shot, or I can give you a parting shot prompt.
Let's do the prompt. Yeah.
What's one mindset shift physical therapists need to make about their clinical identity? That will be your
one mindset shift.
I think you've said it a few times.
Yeah. I think you just need to, just eliminate the noise around you, and like, don't be influenced by what your boss wants you to do necessarily, or what other people are doing around you. Like, find what you want and make that your identity. And if you haven't found it, keep looking. Yeah.
If you need a place to look, that's good too. If you don't know where to look, come to an event like this.
Yeah.
And just listen, look, consume, figure out what you like, and then take bits and parts of your favorite things that you see and make your own thing. Yeah. I'm a physical therapist radio DJ. I literally just made this up. Like, you just make things up.
You're an N of one, right?
Yeah. I would have loved for some help along the way, or like a guidebook, but you can just do things.
Yeah.
And that's how things happen.
Well, and it's part of the growth. Like, the struggle and making mistakes and trying to figure it out. Like, that's part of the journey. And that's what I like about it the most.
Listen, I'm here for a good time, not a long time. Ben, appreciate the stop by here at APTA CSM here in